This video demonstrates EYESIGHT, a robotically aligned retinal imaging system we developed to automatically capture retinal images on freestanding patients. Our system improves on prior work by placing all human sensing capability in a single robot-mounted sensor package, which improves the workspace, increases the visualization of the patient during robot motion, and improves safety. We use a UR5E robot arm for sensor motion and stabilization and evaluate our head tracker, pupil tracker, and clinical sensing modules on a Phantom. We use two monochrome cameras for head tracking and gross alignment, four RGB endoscope cameras for pupil tracking and fine alignment, and an RGB clinical sensor with an off-axis LED to illuminate and capture medical images of the retina through an indirect ophthalmoscope lens. The system begins by sensing the position and orientation of the head. The system will then approach the head to align the sensors relative to the patient. Once servoing lock to the patient's left eye has been achieved, the visual servoing target will smoothly transfer from the head target to the pupil. At this point, while tracking the patient's pupil center, the system will begin collecting a clinical imaging sequence of the retina. Once the imaging sequence has been obtained, retina images will be identified with an image quality classifier and provided to a medical professional for clinical diagnosis. We show that our system is also capable of sensor alignment on humans. The system will again approach the individual and perform head and pupil tracking. As shown, tracking is robust to small head motions. If the individual removes their head from the tracking region, the system will return to the retracted position. The system will then resume sensor alignment if the individual is detected again. Thank you for watching.